Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Uses of sulfonylureas. Right. These sulfonylureas are actually used in diabetes mellitus, especially the drugs like tolbutamide or glipizide. These are actually used in elderly patients. Why? They are used in elderly patients because they have number one low potency and they have shorter duration, and thus they are used in elderly patients. Second, we have meglitinide. This meglitinide, why is it used? This meglitinide is used in the treatment of postprandial hyperglycemia. Okay, but this postprandial hyperglycemia. So because it will help in treating the postprandial hyperglycemia by increasing the insulin secretion after meals, so insulin will release GLUT4, which results in uptake of glucose, which gets converted to glycogen, thus it causes weight gain in the patient.
thank you and thank you for watching.